Recently, I was reading an article about the psychology of ultramarathon runners, and the author described how ultra endurance athletes often use self management techniques to endure the pain. These techniques can be used to help our patients deal with and take control of their own chronic pain issues. The shape and scope of the problem with chronic pain. Using NHIS prevalence rates published in 2017, 25.3 million Americans suffer from chronic pain on a daily basis. It is the #1 cause of long-term disability in America. The purpose of this presentation is to help practitioners teach chronic pain self-management techniques to their patients. Self-management for pain. It is the individual's ability to manage the symptoms, treatment, physical and psychosocial consequences, and lifestyle changes inherent in living with a chronic condition. Self-management technique strategies focus on educational, behavioral, and cognitive areas. These techniques can be used in multiple areas of one's life, personally and professionally. Self-management techniques are based on the 1960s theories of John B. Watson, cognitive behavioral therapy, and Dorothy Orum's self-care deficit nursing theory. Thus, they are problem-focused and action-oriented. The goal is to identify behaviors and thought processes that adversely affect an organism. It is to be used in conjunction with medical and interventional chronic pain therapy. Why engage patients? These techniques help people learn how to manage and control their own health in an effective manner. Self-management techniques help maximize functionality, reduce pain, improve health, help people have a more positive outlook. They also help reduce the cost of healthcare and improve outcomes. Self-management interventions are problem-focused, action-oriented, and patient-generated. The 4 patient skills required are problem-solving, decision-making, resource utilization, and collaborating with care providers. There are some barriers that your patient may encounter using self-management techniques. They may have an exacerbation of symptoms or unrecognized adverse psychological impacts for chronic pain. They may have changes in roles and relationships with family members, providers, friends, and career, inadequate social support, adverse behaviors, and lack of self-efficacy. The role of the provider can best be expressed with the 5 A's model. Ask questions. Assess the why, how, and readiness of the patient to accept them. Advise and agree on an action plan. Assist in behavioral changes and techniques and problem solving. And arrange referrals to community support and schedule follow-up visits to monitor progress. Let's review the 5 A's. Ask questions. You're trying to establish rapport with your patient. You're trying to get information and understand where they're coming from. Ask open-ended questions such as, what is a typical day for you like? What types of things are you unable to do? At the end, you need to clarify, did I hear you say that? Have I accurately summarized your concerns? The second A is to assess. So you've asked these open-ended questions to help you assess for barriers: cognitive, behavioral, psychological, cultural, knowledge level, physical activity level, medication adherence, support, and confidence. What is the patient's readiness to change and be open to these self-management techniques? The third A is to advise. Be clear and specific in your recommendations. Be encouraging and non-judgmental. Help the patient be realistic in their goal setting. Advise patients on how to navigate barriers and build confidence. The advice should be supportive. Advising your patients, you can use the SMART goal system to help them with their goal setting. The S is for being specific in their goals. The M is that the goals should be measurable. The A is that they are action-oriented, and the R is that they are realistic, and T is that they are time-bound. Use practical behavior change techniques such as modeling or walk a patient through the process. Assist by supporting positive self-management skills that boost confidence, social and environmental support. Assist in problem-solving their barriers that keep them from reaching their goals. Complement and reinforce the positive treatments from psych, PT, OT, the chiropractor. The last A is to arrange. So arrange for follow-up visits. Arrange for referrals for treatment specialists that can assist in helping your patient. Arrange for community support. Encourage the patient to seek their own support groups. Make yourself available or call patients to follow up on tests and a treatment plan. You also need to reassess. Does the patient understand how to use the self-management techniques? Does the patient understand their diagnosis, their plan of care, what to expect, when to follow up? Does the patient understand their medication regimen? Do they understand how each of their medications work and what their side effects are? Here's a short list of self-management resources that are free. The UC Davis Self-Management Toolkit is easy to follow. Stanford's online self-management program costs a little, but it's very comprehensive. Most self-management programs cover 11 areas to set goals on education, behavioral, cognitive approaches as they impact chronic pain. Here are the 11 pain management strategy techniques that are in most self-management programs. Pacing activities, healthy foods, appropriate medication utilization, exercise, anxiety and tension reduction, improving sleep habits, shifting focus, thinking constructively, socialize and recreation, improve mood, and use good ergonomics. Is there measurable evidence that self-management techniques have a positive impact on chronic pain? Absolutely. In several reviews of the literature, the improvement treatment group ranged from 9% to 47%. So there's a statistically reliable improvement in health outcomes using self-management techniques. Patients think about self-management techniques. They say their voice is heard. They know they're not alone. They're with people that understand them and they take ownership of their pain. When providers partner with patients on self-management techniques, the patient is 18 times more likely to participate in the process of self-education, intervention, and management of their disease. Quickly recap, providers should use the 5 A's, and patients should be encouraged to use the SMART goal system for each of the 11 areas of self-management techniques. Assist the patient in problem-solving barriers to these goals. Help the patient plan for what they will do if they have a flare-up or a setback in their plan. Let's encourage our chronic pain patients to practice self-care management techniques for better health outcomes. And these are my references.